We are a group of pharmacy, medical, social work, and nursing students who care about childhood obesity in the Austin community. This project came from deep concern about rising childhood obesity rates in certain parts of Austin. According to the CDC, obesity has more than doubled in children and more than quadrupled in adolescents in the past 30 years. 34.1% of low-income children aged 2 to 5 are overweight in the state of Texas.
The fight against childhood obesity is important because it can lead to various comorbidities, including high blood sugar, high blood pressure, type 2 diabetes, low self-esteem, bullying, and depression. Childhood obesity is a problem throughout Austin, but it is concentrated in some neighborhoods, including Dove Springs.
Dove Springs is an area located in southeast Austin, Texas. Children's Optimal Health has identified Dove Springs as an Austin community with a high concentration of obese students, with 1.5 in 10 middle school students struggling with obesity. There are many different barriers to healthy living for children in Dove Springs, including the high crime rate, which can make it unsafe to play and exercise outside. Because of these high crime rates, we decided to work on implementing an after-school program that aims to help students stay active in a space where they feel safe.
We feel that keeping students at school will help overcome the barrier that neighborhood crime places on getting out of the house and staying active. So with these efforts, we hope to combat obesity while keeping students safe, sound, and out of trouble.
We're starting Let's Move Austin, an educational after-school program that keeps kids out of trouble while educating them on healthy foods, providing them with healthy snacks, and keeping them active. Each week, we'll have a different theme, from Pokemon to cowboys, to keep the students engaged and interested and make having a healthy lifestyle cool again. Every month, parents will be invited to come to the last hour of the program to join their kids in preparing a healthy meal or playing a game. This will increase parent buy-in and allow whole family to become healthier together.
Our plan is to conduct a pilot study to see if our program can decrease childhood obesity rates within middle schools in the Dove Springs community. We would like to implement this program during academic years, fall and spring semesters. We plan on holding this after-school program every day until 5:45 p.m., giving parents enough time to pick up their kids or to get home.
Nice pass, man. Cultural factors play a large role in childhood obesity in the Dove Springs area. Data shows that the area, which is growing, consists mostly of minorities, and that the average house is burdened, with over 40% of the houses filled with families. One reason for this is that minorities tend to take in their grandparents and relatives and have more children. This increases the number of mouths to feed and decreases the quality of food. Also, instead of being able to play sports and maintain fitness, children of these families are obliged to come home and help out around the house.
So I know you're all asking, how can I help? Well, we need money. We're looking for $32,230, which isn't very much if you consider that it's completely changing the lives of 30 children in Austin. We need $19,200 to pay our staff to take care of them. We need $12,000 to feed the kids healthy, nutritious snacks at every meeting. And we need $30 for jump ropes for the kids so we can send them home so they can continue to exercise and be physically active at home. And then we need $2,000 for smarts so we can extend the knowledge and the education to the entire family to help these kids make a lifelong change.
It will take all of us, physicians, nurses, pharmacists, social workers, parents, teachers, and children to confront childhood obesity. It is a social justice issue when children in more impoverished areas are being impacted by a health concern than other children within the Austin community are not.
This isn't just a family or medical issue. This is a community issue, and it's going to take all of us to do our part.